am Dr. Eternity Labio, and today the focus of my talk is on hepatitis B and how it relates to the employability of those individuals living with this infection. Many are declared unfit to work because of being hepatitis B positive. We see many of these people in our clinics. The problem has become so pervasive that posters such as these appear on our streets and newspapers, victimizing those hepatitis B positive individuals who are desperate as a result of feeling stigmatized and discriminated upon. But what is really the big deal about this issue? First, there is a concern that a job applicant with hepatitis B will become sick while on the job. Second, being the more concerning one, will the job applicant transmit the infection to others in the workplace? While it is true that a person with hepatitis B can experience acute flares and develop liver cirrhosis and liver cancer, the natural history of chronic hepatitis B infections can be variable, with majority of individuals living an otherwise healthy and productive life, particularly when properly monitored and treated. Now let's move on to answering the question, is someone with hepatitis B contagious in the workplace? Can he pass on the infection to others? The risk of transmission depends on the type of occupation and the infectivity of the individual as determined by his e-antigen status and the level of his DNA. At this point, it is worth emphasizing that hepatitis B has not been documented to be transmitted through ordinary workplace activities, food preparation, sharing utensils and plates, sharing office supplies and computers, handshaking, hugging, and even kissing. The risk of transmission is actually highest for Category 1 occupations. These are healthcare workers who perform exposure-prone procedures or EPPs. EPPs are defined as the simultaneous presence of the healthcare worker's fingers and a sharp instrument in a poorly visualized space. Given this definition, not all healthcare workers should be considered at high risk for the transmission of hepatitis B, especially those that are not involving the performance of EPPs. All other occupations outside the healthcare setting are considered low risk for the transmission of hepatitis B. The risk of transmission is highest for Category 1 occupations with an HBV DNA level of greater than 2,000 IU per ml. Here you can see that for those applying for Category 2 and 3 occupations, those not involving the performance of EPPs, an HBV DNA determination is not required. This algorithm summarizes the evaluation of HBsAg positive individuals undergoing a pre-employment evaluation. Only when there is associated hepatic decompensation from liver cirrhosis or from liver cancer will someone be considered not employable. Only those applying for Category 1 occupation should we request for an HBV DNA level as a prerequisite for employment. Those with an HBV DNA level greater than 2,000 IU per ml should not be allowed to perform exposure-prone procedures until such time that their HBV DNA levels are lower than 2,000. For all other occupations not involving EPPs, there is a low or negligible risk of transmission in the workplace. Therefore, these individuals should be allowed to work with no work restrictions. Declaring them fit to work may not be enough. We should issue a pre-employment evaluation clearance that includes the following: the phase of infection, whether in the immune tolerant, immune clearance, or inactive carrier state, whether there is a low or high risk of transmission, given the nature of job being applied for, whether there are restrictions involved, as well as the plan for follow-up and monitoring. In summary, these guidelines were made with the ultimate objective that a positive hepatitis B surface antigen results should not be a basis to discriminate, restrict, or disqualify a job applicant from being gainfully employed. A hepatitis B positive applicant should not be declared unfit to work and denied employment without appropriate medical evaluation and counseling. Hepatitis B screening in the pre-employment setting should not be made mandatory. Screening should be performed only if applying for occupations at high risk for transmission of hepatitis B in the workplace, and that the minimum requirements for a confirmed HBsAg positive person undergoing pre-employment evaluation should include the serum HBe antigen and anti-HBe, a serum ALT, and an ultrasound of the liver. Take note that an HBV determination is not always needed in the pre-employment setting except for occupations involving exposure-prone procedures. These statements are embodied in the Department of Labor and Employment Advisory that was released in January 2010 on the implementation of a workplace policy and program on hepatitis B. Hopefully, this will pave the way towards non-discrimination of hepatitis B positive individuals in the workplace. Thank you very much.